Hi, I'm Dr. Bob Conrad with Southwest Clinical Technologies. And at this time I'd like to go through and give you a detailed explanation of the Southwest Clinical Technologies CEREC in Your Own Backyard programs. You see, we began development of CEREC in Your Own Backyard after having the opportunity to talk with a large number of doctors that we've trained in the CEREC technique for the past number of years. You see, what we were finding from doctors was this. They were looking for a cost-effective, time-effective way of having CEREC training. You see, we used to go through and have doctors come into Houston. They'd fly in their staffs, stay at a hotel, and in many times have to take an inordinate amount of time away from their practices to go through and gain continuing education knowledge in the CEREC information and CEREC technique. You see, I started taking a look at it from my perspective. If I had to leave my office on a Thursday afternoon early, put everybody in my staff on an airplane, pay for their hotel accommodations and their meals, and realizing that they're taking time away from their families and their lives to go through and gain this information, and then realize that I had a course tuition on top of that, what we were finding is that many doctors were spending $6,000, $7,000, $8,000 to attend a program on CEREC education for just 2 days. What we found, and one of the doctors probably coined the term for us, they said, Bob, what we need is the CEREC to come to our backyard, not yours. We don't want to fly halfway across the country to go and sit in a lecture hall all day long. What we prefer is to fly you out here, get our group together, and have you present your information to us. That brought up another interesting point. You see, we were utilizing at that time a hands-on approach to CEREC training, where doctors would hear a portion in a lecture and then go sit at a computer terminal for a period of time and practice the technique that we gave them. Here created the problem. You see, we had doctors in there who were new users, who, to be honest with you, were a little slow on the trackball. We had other doctors who'd been utilizing the CEREC technique for a number of years, who literally could spin the trackball from point A to point B knowing what was going to be going on. They wanted to learn the techniques, the protocols, those things that make me and my staff clinically efficient with respect to the CEREC system. You see, more and more doctors were telling me, Bob, you know what, we enjoyed your program. However, you didn't go into as much detail, or you weren't able to cover as much as I wanted to hear. Yet on the flip side, we had doctors that needed to hands-on time. So here's what we did. See, in our CEREC in Your Own Backyard programs, the slides that you see appear on the screen are presented and given to you on a CD in Adobe format, literally allowing you the opportunity to, in the comfort of your own home at your own office, to review the physical slides that you saw presented at the program. Then coupled with that, on that same CD that we provide to you, we provide to you every data file so you can load that on your CEREC system and follow along step by step by step, gaining the hands-on experience that you need with respect to CEREC, but at the same time having the opportunity to gain the knowledge that you need. You see, I can effectively teach 3, 4, maybe 5 topics in detail in a 2-day time frame with respect to CEREC. But if I'm strictly lecturing and allowing you to go home and do some homework, I can get through as many as 15 different concepts, different protocols, different techniques, different utilizations of the CEREC system to create knowledge at the advanced level. You see, CEREC in Your Own Backyard is not intended as a basic training. Patterson provides a basic training protocol for you. You then need to practice the techniques that you learned in your basic training. Our CEREC Encyclopedia provides basic training and intermediate training. But if it's basic training that you need, I recommend that you get our CEREC Encyclopedia, then come to see one of our CEREC in Your Own Backyard programs. Because then, with the combination of the actual slides that you will see during our presentation and the CD with the data files, you can practice at your own pace and not feel rushed or not feel slowed down during a CEREC in Your Own Backyard program. You see, our advanced training programs are broken basically into 3 separate areas. We have our advanced posterior introduction to anterior program. Now let me explain to you what I mean by that. We focus heavily for the first day on posterior designs. Specifically, we go into the software. We discuss how the software is utilized, where the various windows are within the CEREC system that are never touched on in the basic training that make CEREC protocols and designs go more efficiently. Then we go into the design concepts. This is an area where I talk about my decision-making tree. What do I do when? Why? If I'm doing this style of restoration, I'm using this type of design technique. Why? When I'm going through and I see a restoration that is severely broken down, I'm going to use a dental database with an antagonist. And why? You see, if I just stand up there and tell you do this without an explanation as to why it's beneficial for you, the protocol will not become a part of your day-to-day persistence within your practice. Then we go into the preparations. See, we've commissioned a number of different animations and a number of different graphic illustrations to show you preparation forms within CEREC. You see, I've always said, never attempt something with CEREC that you wouldn't take an impression of and send to a lab. Yet daily I see problems that doctors have encountered because they're pushing CEREC to do something that they would never ask a laboratory to do. You see, we talk about the preparations. We go into detail of what works and what doesn't, why it works and why it doesn't. See, then we're going to go into preparations with respect to the instrumentation that we use, what I call the burrs in the box section. You see, different doctors like to see different things, but through the number of years since 1996 that I have been using CEREC, I have learned from other doctors and developed protocols of preparation on my own using specific instrumentation. I want to openly share that with you so that you might find that you can be more efficient in using maybe some of the same techniques that I do. Then in this section we go into the correlation designs. We go into correlation designs with respect to full crowns, and we go into respect to correlations with respect to inlays and onlays. Why do we start with correlation? Why should we even ever consider correlation as a design? We start with correlation because of one very simple reason. It keeps the genie in the box. It holds the genie in the bottle. You see, with a correlation design, your top is finished. Your margin is preparation. The only thing that CEREC does is design the contours. You see, you have a top and a bottom. And by having a top and a bottom, all that CEREC has to design is the proximal contours. And you create a very proficient, very efficient technique when utilizing a correlation design. Correlation is literally 1, 2, 3, 4, and mill. Then we go into our antagonist design. Why do we do antagonist second? Because it is a much, much more involved procedure. You see, in antagonist designs, you open the bottle. You let the genie out. CEREC's going to control your top. It's going to control your bottom. It's going to control your contours. Literally, the only thing that you have control of is the preparation margin. CEREC does everything else. See, in the antagonist, there are far more variables that you must get under control. So we teach you how to get those variables under control, how best to utilize the antagonist design, again, to create a predictably ideal result. Along with our discussion of our antagonist designs, we go into the antagonist contacts. We specifically discuss the occlusal and interproximal contact development. The next concept that we discuss with respect to this area is the correlation ghost design techniques. Again, inlays and onlays. We go into how to use this with full crowns and best when the correlation ghost is utilized. Then we go into the CEREC materials, discussing those materials as to what material works best when and where. Why I like Vita over Ivoclar in certain areas, why I like Ivoclar over Vita in various areas. Because there are times when IPS Emax is my best material, IPS Empress is my best material, and Vita my best material. See, different techniques, different clinical displays require different materials. Hence the reason that we have the ability to select these different materials in all these different areas. Then we go into the parameter settings. We go into parameters in detail because it is something that is not even discussed with respect to your basic training. We go into the configuration options. Again, areas that are glossed over in many training programs, but it's your area where you tell the CEREC system what you expect it to deliver to you. See, we go into the posterior correlation quadrant. Why we recommend a correlation quadrant over any other technique when you first begin doing quadrants. Then we go into the anterior preparations. Specifically, what we focus on here is an introduction to the anterior. We talk about the anterior crown, its preparation, the anterior design with respect to correlation, with respect to correlation ghost. We talk about how to design two anteriors side by side. We talk about a technique that we developed here at Southwest Clinical Technologies called the modified margin technique, and how it can be used very much to your benefit to create an ideal aesthetic result. Then we go into the oops section. That part of my presentation where I show you my dirty laundry. Those sections where I made mistakes, those clinical failures, if you will, that I've had, in hopes of going through and preventing you from stumbling down the same clinical failures. You see, y'all, I could stand up in front of a group, just like many of you could, and lecture and show you my pretty dentistry, picture after picture after picture, ad nauseum. But would you learn anything? Would you gain knowledge from looking at pretty dentistry all day long? I don't think so. You see, I enjoy it when a clinician shows me their mistakes, shows me where they went wrong and what they did to correct their errors. That's what we do here in the oops section. And it's my hope that by sharing with you my mistakes, that I can prevent you from having similar experiences, or if you ever do encounter those experiences, how you can recover from them and create ultimately the most ideal scenario for your patient. Lastly, we go into the indirect technique. Y'all, I'm simple with this. Just because CEREC can be utilized as a direct technique doesn't necessarily make it the right technique or maybe the easiest technique in every protocol. Y'all, I do CEREC restorations on second molars on a regular basis. But you know what? There are times when try to imaging an upper second molar on a guy with big jaws and a hyperactive saliva gland that's nearly impossible. Take an image of an impression, and we show you in this indirect technique an economical, rapid impression-taking technique that results in a model ready to image in 3 minutes. Y'all, this is an exciting technique, and I look forward to having the opportunity to share it with you in this section of CEREC in your own backyard. Our next section of CEREC in your own backyard is our advanced posterior implant program. Now, this posterior implant program is truly an advanced technique. We go into, at this point, keys of designs, design concepts and our successes. We go into more detailed imaging, beyond basic imaging, beyond the single tooth, beyond the areas that you would normally encounter with respect to imaging with the CEREC system. We teach you why specific images are beneficial and why certain other images are not. We teach you when to keep images and when to discard them. We go through and review our design concepts with respect to our posterior correlation design and respect to our posterior correlation design crowns with respect to also anteriors. We touch on the anteriors in this section simply because we want you to gather that information when we start talking about implants. We go through the antagonist crown design, the replication crown design, and then we begin delving into the posterior bonded antagonist implant crown design, as well as the bonded correlation implant crown design. We talk about how to fabricate a screw-retained implant restoration with CEREC. Yes, it can be done, and it can be done very effectively and very efficiently for those of you that want to have an implant restoration that's still retrievable by screw. We also talk about how to handle two restorations splinted together with respect to both implants as well as natural teeth. Then we go into the materials and talk about making them match. What materials to use when and why and how with respect to your implants. We also then go into your parameters and specifically what parameters need to be altered when doing various implant designs. In the advanced anterior program, we focus now totally on the anterior. You see, in our previous CEREC in your own backyard program, we talked about the posterior restoration and an introduction to the anteriors. See, in this section of CEREC in Your Own Backyard, this, if you will, third lecture within the series, we go into the design concepts and again, our keys to success. Here we begin talking more detailed about the images that must be acquired when we start talking more advanced anterior restorative techniques. We go into the anterior preparation again for veneers and full crowns, for incisal wrap veneers, as well as just facial veneers. We talk about the anterior correlation ghost, and the anterior dental database design. We again talk about how to do the two anteriors side by side. We talk about development of the anterior 6 and the anterior indirect technique. I always say plain and simply, when I'm using CEREC in the anterior clinically, I determine at the start of that procedure, is this patient a patient that I desire to have done in one day? You see, what I teach in this section is that there are times when the very best thing to do is to put that patient in provisionals. I heard it once said that it's the very best thing to do is practice in plastic before you perfect in porcelain. I love that saying, because what it means is this, plain and simply. Develop your anterior guidance in your temporaries, your plastic restorations. Get your anterior length correct in plastic, your temporary restorations. Get your aesthetics correct. Get your speaking space correct. Because y'all, if a patient can knock off a provisional restoration, they're going to shatter your glass every time. You see, what I don't want to have happen is for me to go through and rapidly throw a patient into porcelain when I come to find out 6 weeks, 6 months, a year down the road that I did not have their envelope of function properly developed. You see, there are times the best thing to do is practice in plastic and perfect in porcelain. Again, a saying that I absolutely love to quote because it is what sometimes will dictate my development of the anterior restorations in direct. You see, we go through on how to transfer that patient wax up to the mouth to allow you to correlate. We talk about correlation from that wax up. And again, when it is best to provisionalize as opposed to going straight onto those CEREC restorations. We go into detail on milling the anteriors and how that milling and preparation can affect ultimately the aesthetics of your restorations. We visit more on the polychromic blocks because here in the anterior is where I use the Ivoclar multi-blocks as the mainstay of my restorations. While in this specific course we do not go into the full mouth rehab with CEREC, that's a course that we are actually in the development of right now at Southwest Clinical Technologies, and one that I'm truly excited and hope to be bringing to you in 2010. But we talk about why to utilize this specific block and how it can create ultimately a beautiful aesthetic result. Because making the match in the anterior is sometimes our greatest challenge, but is something that we go through and teach you some very simple, yet very effective, yet definitive techniques in the anterior. This is where we talk about staining for aesthetics, creating characterization, bringing in those little subtleties that allow anterior teeth to have the true beauty that we expect for them to have. We also talk about the add-on, because there are times when going through and finding that you need to add ceramic or create an incisal translucency can be very beneficial for you with CEREC, and we discuss how to do that. You see, these programs of CEREC in Your Own Backyard are brought directly to you. We go through and work directly with Ivoclar representatives in the area to bring to you CEREC in Your Own Backyard. We can go through and bring any combination of these programs to you, to a study club, to individual groups, to anyone that would like to have us come to you. All that you need to do is get in touch with your local Ivoclar representative or visit us at www.drconrad.com. You see, with our website, you can find out where we're going to be, or you could feel free to call us here at Southwest Clinical Technologies and find more information out about when we're going to be in your area, or if you would like to have us to your area. See, if you just have a study club that can put together 15 doctors, usually that's all we need to be able to make it efficient for us to come and visit you in your own backyard. Y'all, I have great excitement when I have the opportunity to lecture on this. CEREC has become a mainstay in my practice for everything that I do on a clinical day-to-day basis. I look forward to having you see us at a CEREC encyclopedia or a CEREC in your own backyard program. I'm Dr. Bob Conrad, and it's been my pleasure joining you today. Thank you.